Good evening, everyone. I am Henna Bhandari, National Officer of Human Rights and Peace. Thank you all for joining in today on the webinar on adolescent health. Adolescence is a time of great transition between childhood and adulthood. While definitely not children anymore, teenagers are also not considered as adults and hence don't have the rights that adults have, leading to many struggles for adolescents. Ages 10 to 19 are among the most critical for human development, yet one of the most poorly understood stages of the life course. So to emphasize in detail on the importance of adolescent health, we have Dr. Jugal Kishore here, the Director Professor and Head of Community Medicine Department at Vardhaman Mahavir Medical College and Safdarjung Hospital, New Delhi, and is also the Honorary Secretary General in the Indian Association of Adolescent Health. He is a medical educator and public health expert and had been actively involved in social, mental, and environmental health movements in India. He has more than 240 researches published in journals, in magazines, and in dailies, along with authoring many books on public health, national programs, social reform, and nationality. Thank you, sir, for taking out time today for the webinar. I would quickly request all the participants to keep their mics on mute at all times. After the webinar, we will have a 15 to 20 minutes question and answer round. So please keep your questions ready towards the end of the session. We will also have a post-event webinar questionnaire. Please do fill the questionnaire. With this I will pass the mic to you, sir.
Thank you very much. Hina Bhandari. You are from which college?
Sir, I'm from MMI MSR Ambala.
Oh, great. Wonderful. Thank you for introducing me. You rightly said that I am the Secretary General of Indian Association of Adolescent Health. I'll describe that association when I'm going to talk about adolescent health, because without talking about it, it's incomplete that what is going on in the country and also abroad. I'll share my slides and will continue what I want to say. So can you see my slides now?
Yes, sir.
Oh, great. Yes. So you said introduction. Yes, it's a kind of introduction because we don't talk much about adolescent health in our schools and also in medical college. In medical college also on adolescent very poorly. The syllabus is very poor and we have no idea how to deal with adolescent. So we'll discuss all, and I hope in the end, if you are sensitized a little bit towards adolescent, I think we have reason for why not. We have so many reasons why we should not be focusing on adolescent health. So I'll try my best how to convince you that you should give your small, amount of attention towards this adolescent. So first is why we should talk about. The very purpose of this is that it's a huge population. It's 1.2 billion population in the world. And if we talk about India, then it's almost 20% of the adolescent population of the total population. So it amounts to almost 253 million population. So it's a very, very big number. Another one is this is the power, adolescent and youth power. You can imagine that this is the one which decide today the politics. And the politics is deciding your future. So any country in the world, particularly India, because we have the younger population much more than any other country. Therefore, what kind of politics is going to be there if they are not educated, if they are not sane, if they are not logical, rational. I think we are going to have our power or maybe government which may not be suitable for the development. Therefore, their involvement in every field of life is very, very important. Another reason for our doctors is that large number of problems, particularly which are not common in other, but they are common in them. And if we talk about 10 causes of global death among adolescents, that is the road traffic accidents, which is emerging to be the top 10 cause of disability, adjusted life year loss, and maybe I think you can say the deaths in the world. Therefore, if we want to decrease the road traffic accident, we have to focus on adolescent health. Then HIV, self-harm is a very, very big problem in which the suicide also comes. Then lower tract infections and interpersonal violence, then diarrheal disease, worm infestations, meningitis, epilepsy, endocrine and other blood immune disorders are also common. So they are the major cause in the world. But when we talk about daily loss, then unipolar depression, which includes suicidal tendency and suicidal attempts. You can imagine that whole world in this age group, people are having this avoidable problem in them, and they're suffering. Say a lot of trauma is there in that, mental trauma. Then the road traffic accident, the iron deficiency anemia. Very unfortunate that on other side we have so much food, but one side we have the deficiency disorder, and that too in the adolescent, and it has repercussion in various part of the life. So the 10 leading cause of daily loss in the world in adolescent is you can see that red color and blue color. So the one is the male and female differentiation. You can see which one is more common. So in male, you can see the road traffic accidents is much higher as compared to unipolar depression. So you have all distribution. So you can say that we have the number of illnesses which are very, very, troublesome, and they are all avoidable. Therefore, we have to focus on adolescent. When we talk about mortality, again, I'm just not showing by the graph, but also by number, and that shows the injuries and complication due to pregnancies and road traffic accidents and suicide. These are. So the question comes that are they preventable? I'll say yes, they are preventable. Therefore, we require a lot of intervention study for prevention of this mortality. And these young doctors like you has to think what intervention are designed and should be designed to prevent them. These are major issue which has been discussed, but we have to focus on the risk factors and the disease, and you have to club all the risk factors so we can focus on what are the risk factors which lead to various kind of disease, in which I think that tobacco, alcohol, and violence, and maybe I think you can say the anger has come into that place. This is very interesting one. The addiction start in this age. You just look at it, that teenage, that is 12 to 17 years, you have the 67% of the addiction as a development disorder, we can say. And after that, it decreases. So actually the old person, an elder person, do not develop the addiction. It is this age group where, he started some drugs and then leads to addiction. Therefore, our focus on this age group is very, very crucial. Next one is, is developmental issues. The teen brain is, different from other brain. And therefore, we must understand what is going on in the brain, in the brain of the adolescent and teen. You can see that previously we used to say that maybe I think after the 2 years, the development of the brain does not occur. It's not true. It keeps improving and keeps, developing the sinuses and networking, which you can see even at the age of 20. You can see that throughout the age, you will find that graying of the, brain continue. And now the evidence are showing that even in old person, you can have some kind of change, and that also a kind of development can occur. So the brain keep improving, and that's a very interesting finding. today that we should not stop any point of the time that it's the end of the learning. The learning continue, and you can change your brain accordingly. That's the most important part of learning, and that is known as a neuroplasticity. So this is a new concept which are emerging, and I think it's going to be very helpful in future. So you can see that if we have neglected brain, then what kind of brain we are going to have as compared to normal brain. This I want to tell my all the students that when you are dealing with adolescent, try to understand that what is going on. Here we have two brain. One is two part of the two component of the brain. One is a prefrontal cortex, other is a you know limbic cortex. Now in limbic, it's a emotional and rewarding type of development occur. So that occur very fast. On the other side, the prefrontal cortex, development of the adolescent is slow. Therefore, there is a gap between the two, and therefore they are actually not very good planners and not logical. They are more emotional and impulsive. Therefore, we have lot of issues. Like we can see, because of that, they develop substance abuse. They are self-harming because in impulse they take some decisions. They become depressed. So you can see that when you are, handling this kind of child or a adolescent, we should understand that it is the brain, development going on. So nothing is wrong. This is a part of their development. Therefore, when you are dealing with, I think you can understand them better. And if adolescent himself understand, I think it is better. It's also known as a psychoeducation. If every student learn that what is going on in his brain, this slide is also very, very interesting. I think the lecture is given this slide, and I think everybody should focus on it. This is again is focusing on adolescent. Why we have to talk about adolescent? One is that actually 18% of the adolescent develop tobacco. They continue to take tobacco. 50% of them continue to be a smoker, and leading to 7% of death and
Hi everyone, there must be a connection drop. Let's just wait for a couple minutes and Sir will join back. Till that time, we would like to inform everyone that tomorrow MSAI is launching an activity on adolescent health in collaboration with SCOF, SCORP, SCORA, and SCOMI. It is an all activity based standing committee collaboration, and we specifically decided to launch it tomorrow on Children's Day because it will be special since it's adolescent health. And if you all would be interested in conducting the activity, then you all can fill the DAF and do conduct the activity because it's going to be really fun. For the first time, we have such a huge collaboration between all the standing committees. So, looking forward to a lot of events, a lot of enthusiasm, and a lot of support from all of you.
Hello.
Hello, sir.
Very sorry.
No, no issues, sir. We can hear you now.
Okay, I'm sorry. Uh, Let me share my slides again. And I don't know what happened. Uh, yeah, now I can start.
Yes, sir.
Okay, I'm sorry. Maybe internet again. Uh, yeah, this is a disadvantage of such platform, but I think it's good because large number of students are there. Although it is only 50 people are shown there. I don't know, 50 or 60. So I was talking about this slide, and this slide is actually showing how the habits or maybe the risk factors we develop in our adolescent actually leading to their adulthood and also, and into some of the mortality and maybe I think morbidity. So you take an example of that people who are having insufficient activity in their daily life. So 30% now in India also, there is huge number of students are now becoming inactive, and that inactivity it is as high as 25% or 20% of the student. And in some of the students, when they are reaching to their 12th class, then it becomes totally, huge number of students are becoming inactive. This inactivity become the habit, and that becomes their addiction, and then lead to lot of problems like the breast and colon cancers, then diabetes, and then ischemic heart disease, and then leading to deaths. You can imagine that this inactivity is not a good thing. Sometimes we feel that no, life is very important. When we study, when we get the grades and these all things, and then keep reading and studying without giving importance to physical activity. Similarly, in case of alcohol, 14, we already have 15 to 20% of our students are getting involved in intake of alcohol. This habit continue, and 47% of them will continue to have this habit, leading to again so many alcohol related disorders and diseases. Another one is a mental disorders. If you develop some kind of mental disorder in young age, then around 50% of them continue to have this problem after 25 years of age. So this is showing that if you want to prevent large number of disorder, you have to focus on adolescent. That is why we have to talk about adolescent. In conclusion, I just made that almost 70% of our adult life diseases is actually because of behavior and habits which we initiate in our adolescent life. That is why our focus should be on this age group, where we can have the good habits in them. Anyway, this is not a new concept that the younger, lot, or maybe the current students or maybe children are not doing what the older, you know, or in our age, or like maybe our parents always say that we used to be like this, and the youngsters never like this statement that, if their parents say that I used to do this and you are not doing this. So sometimes you feel, no, this is not true. And I think this is a very good quotation. And I don't know if anybody knows who has written this. Very nice. If you read it, I think you will enjoy it. The children now have luxury. They're bad manner and contempt to the authority, and they allow disrespect to the elder and love chatters in place of the exercise. Children now are tyrants and not the servant of their household. They no longer rise when the elders enter the room. This is a common, complaints of our, like the we teachers. We always say that, these young, at, the first year students, they don't have any manners and all that. But actually, this is written by Socrates. You know, so we have not changed much. But similarly, it is saying that, these are the young terrorists. We always say that these are the young terrorists, and they are very. But this is not true. Again, this is showing the study. Some of them will be, having some kind of. So again, you can see the normal curve. Some will be very, very common. Some will be a little, naughty, and some are will be having some abnormal behavior. That's fine. That's a growth. That's a natural for. So not every adolescent is going to be terrorist, or not every adolescent is actually. We all passes through it, and not everybody has done all those nonsense things which are actually blamed for. So with this background, I think the government of India has already launched. Fortunately, although we were without any program for so many years, but recently we have this National Adolescent Health Program, and it has focused on the 6 areas. And these areas are very important on the basis of what we have learned. That is the nutrition, sexual and reproductive health, and the condition of NCD. The all risk factors can be focus here, so we can control later on the NCDs. Substance abuse, then injuries and violence, and mental health. So these are the priority areas of the program, and they have said that this can be done by various interventions. And this intervention is community based intervention, in which the peer educator is going to be trained, and they will be part of this activity. They will be teaching or controlling, or maybe I think not controlling, but they are helping the youngsters. Then there should be quarterly adolescent health day, so focusing on adolescent. Weekly iron folic acid is already now distributed in schools, so focusing on iron deficiency and folic acid deficiency, or any kind of anemia can be controlled by through this. Menstrual hygiene has been added, so reproductive health and menstrual hygiene is beginning of that. Reproductive health is also started, which is also now part of most of the activities in the government program. Then facility based intervention, which used to be before, and actually this program is the beginning of when you used to have this adolescent friendly health services. This was started, adolescent friendly health clinics. They were started long time back, and through that, this concept has come that we can have more services. So this facility based intervention, like having more such kind of center in the hospital, community health centers and all, so we can provide better services. Also maybe to some extent, like the we have the school, so in a school we can provide some kind of services that become a facility based. Then convergence of various programs, like the school should come forward, the youth ministry should also come forward, then education, and then also the health. Then only I think we can handle this adolescent group, because they are coming to to our schools. And in schools, merging with the school health, we require some kind of convergence or help of each other. And then within health and family welfare, we have various programs like the NCD. So NCD should be merged or say having some relationship with adolescent health. Reproductive health is also should be linked with the adolescent health. Then only we can have a better outcome. So that is the within the health and family welfare, and also out of the family welfare, other departments. So that is the convergence. And then we have to have the advocacy of this issue, adolescent health, and BCC and IPC should also be there. Although in many of the areas, we are not very good, but some are doing very well, other are not doing. So you can see that this youngologist redefined as adolescent and youth. The adolescent come with a little, Latin words that say adolescere, that is to grow to mature. And we all know that this age group is actually 10 to 19 years. And this is the most, you know, most accepted definition of adolescent accepted by the WHO also. So this age group is called as adolescent because from child to they become youth, and this youth is 15 to 25. So we have the merge or say the overlapping of the two age groups, adolescent and youth. That is why uh, we work on adolescent and youth together. So this is a better classification of early, middle, and late. So you can have better interventions in this age group. The intervention required in early adolescent may not be applied in late adolescent. You can see the difference in 10 to 13 years and 17 to 19 years. So therefore, if you further divide the age group, it becomes easy for many interventions. And then youth and young. So that's a way for various kind of interventions. Now, this is already known that India is already having almost, I have already said 20, uh, 3, 20, 2,500, 253 million adolescents. But in percentage, it comes to be around 20%. Plus, if we add to young population, then it comes out to be 35 and 36%. So 36% is a good number, and on other side we have pediatrics, which is dealing with the children. We have the obs gynae, which is dealing with the women. But adolescent, which is a huge number, we don't have a specialized branch. So therefore, it is neglected. Neither the medicine people nor the pediatricians are looking after them. That is why it's a neglected lot. So some kind of uh, uh, attention is required. So this group is already known that we have the need of the conceptive, and people are getting married in India, particularly in our rural areas. Most of the women, most of the girls are getting married in adolescent. Therefore, they have many problems and leading to deaths also. Similarly, we have the group here, uh, which can understand that recently we have many such cases where the women has been used, or say the girls, or say the adolescent has been used for sexual violence, and the rape has been occurred. Then so you can understand that why young right is violated, why, what is the level of awareness, and is there is a social, legal, and health problems. So you can see that we have enough dots, we don't have concrete data, and also based on that, showing that how many of our young adolescents are suffering from such kind of turmoil which is happening in the country, and what action we are taking. So these are all research question going on. If you say this is not my job, as a doctor, if you see this one, but no, these people are coming to us, they are getting the examination, and also we are certifying that the rape has occurred, and later on kind of mental disorders and mental problems occur, and then we have the relationship of body and mind. So not only just his she will come with the mental problem, but also so many physical problems. And if you do not understand the relationship of two, you will never understand what is going on in the child. Then we have a problem of nutrition, which is already understood by all of you, that we eat so many things which are actually not appropriate, and that is why we have this problem of malnutrition. Malnutrition is overnutrition and undernutrition, both are there. And then anemia, anorexia nervosa, use of steroid to develop the body, then consumption of slimming drugs. So you can see that mix of abnormal behavior, which you can see in our youngsters, and leading to so many problems. You know, you will find that there are bone problems, there are muscle problems, there are skin problems are there because they use a steroid, and then infection occur in them. So this is all because of their body perception. Anemia, which should not be there in our country, but unfortunately you find that almost 50% of our adolescent girls are anemic. Why they should be? You know, they should not be anemic, but unfortunately, and when they are anemic, then they become pregnant, and then they have the child which is again malnourished, and then the child die. So that we have the child mortality and maternal mortality is high because of these issues. Then mental health. So we require a lot of studies, particularly in this age group, and very few studies are there to have the school health is the very good area where we require. I think all these are mixed up. So we are doing a lot of activities. You can see that this is the school health program. I personally go to schools and deliver the lectures and interact with the student, solve their issues, not only of the nutrition but also of their aggression, behavior, violence, and sometimes their smoking habits. All we discuss, and we find that they are learning. So what I want to say here that through our programs, various programs, the school health program and also the college programs, we are interacting with the students, and then we are learning from them and they are learning from us. So this is how our Indian Association of Adolescent Health is working. This is the college program in Goa. This is the common radio programs. Teen Talks was started in common radio, community radio in Delhi. And we used to go to JNU and used to discuss with the youngsters about their various issues of health. So our doctors can play a very significant role, involving in the community radios. They can have the talk, they can have a direct interaction with the these youngsters, school children, and can convey many things. So the involvement of our medical student is quite good. This is another one. This is happening in South, and you must be aware that they are conducting conferences for undergraduate students. The Kerala is the Kerala is very active in this area. I went to one of their national conference and delivered my talk and motivated them and release our journal over there. Through various activities, we are trying to involve various groups and helping them. This is one group which I found very nice. That these are the community, illiterate tribal girls, which through the models designed by them and prepared by them, teaching each other about the various health issues, including their sexual reproductive health. How the menstruation occurs. So they created model in which they show that how the blood flow, how the walls shed, and they use the cottons and red colors. So that's a more innovative techniques, indigenous techniques using. This is the way they teach each other, and these are the volunteers from the group only. This is another one which we have experimented in Vardhaman Mahavir Medical College. This is the group, and this group has involved. Actually, you can see young adolescent only. These are the school children have made the film on how they experience when they go uh, to the hospital. It's very interesting. I learned a lot of things from them. And then one film was there that how the teachers avoid teaching them reproductive health. So the two films I have witnessed. So that I have allow them to interact with our doctors in Vardhaman Mahavir Medical College, and that was a wonderful learning for us. This group later on become part of our training of interns, and that exercise was also very good. These national level, meets keep occurring, and this is the example of Bhopal. We have gone there and delivered, UNICEF. With the UNICEF, we have conducted national conferences also, where we allow our undergraduate student to come and present their papers and attend the papers. We have conducted international workshop also. So these are various activities I'm showing. This is the last year we have done national conference uh, in Karnataka, and this is the Bangalore, where you can see the NIMHANS director is sitting over there, and the person who is speaking is actually running a big, you know, school chain of schools in a very innovative and totally different way. So, when these people are there and you are joining hand with them, you learn and they also learn from you. And we create a new environment for the country. So, such kind of activities are really rewarding for us. Uh, this association has the website. This is the website. You can go to this website and you can get various kind of information. And this old lady is actually the president of Indian Association for Adolescent Health. And these are all nurses. And her name is Prema Bali. She was a professor of community medicine in AIMS, New Delhi. And she's the one who has started in India, in 60s, the sex and marriage counseling clinic. That was a very bold step done by the female in 60s, talking about sex education. So that is why this party is very good, and I appreciate the people who are talking on these issues boldly. And I'm fortunate to be the student of her. When I was in AIMS, I have undergone training in sex and marriage counseling clinic under her. So since then we had a good relationship, and now uh, she's the president and I am. This is the journal. So you can send your papers and your viewpoints, your questions to us, uh, and you can find some of the research articles. Your articles can also be published. You are doing a little bit of some study on adolescent and youth, then we can publish, and the ranking is quite good. The Google Scholar readership is also good of this journal, and I'm the managing editor of the journal. Our various activities also appear in the newspaper. So you can see the Kishore and Yuva's की सोच बदल देती है सत्ता. So that's one. You can see this was the news of the one of our uh, in Haryana, and he's the district commissioner who is standing there. So these are the priority recommendation we have given, that we should have a state branch, and we are having now almost 9-10 branches in the country. We are holding meeting, workshop, conferences, and adolescent to adolescent program is our very good program. We have the school to school program, and also adolescent to community program, where we allow the school student to go to the community and interact with the older people, and so they school students learn about the health, when they go to the family and talk to the person who is having hypertension, diabetes, or so just a school student talk to them, then I think they learn more about the disease when they are having patient at home condition. We are also conducting some research with the help of ICMR, UNICEF, and WHO. This is the activities which we advocate. One is the parent education, which is very important because parents in various schools. Then we have public-private partnerships. They see so the policymaker can listen to us. And then we have this team talk, which I have already said, and we involved a school student for our team talks, and designing the program for them through social medias like the community radios, then counseling services, peer education, teen clubs, and these are very important activities which we are doing. Now come to you. That was the last component which she has asked me to talk. Your vice president, Molly, she said that something to be said that what medical student can do in adolescent health. Actually, my whole lecture, you can see that my session is on that how medical students should be oriented towards it. So what you can do, first of all, I advise every medical student to at least orient yourself and sensitize yourself to adolescent. Actually, you have recently just when you are in first year of MBBS, you are yourself as adolescent. You are understanding that how the things are happening in your life and others' life. So when you know it, then you better start realizing that how we can improve the condition of adolescent. That's a one. Another one is that you try to attend workshop, training courses on adolescent. So you become more skilled, more powerful in their competencies. Then understanding the role of adolescent health. So your understanding that how you can involve the parents, teachers, and community in adolescent health. Their role is very important in adolescent health. So how you can interact with the parents, teachers, and I told you when you become a little bit oriented, then you learn how to deal with adolescent when you as a parent. So you can talk to the parents. So you become a good parent. You know your parents behave in what manner. You know the friends' parents behave in what manner. So you are better equipped. And now you are a medical student, and I know, and you must be knowing this. As soon as you become medical student, the people start listening you. You know, if you remember, that is the very important part. When they are listening you, please tell something good, which is going to be helpful to them. Next is preparing self to train parents. You know how you can train them. So training skills should be learned, and the teachers training. So you can go to your own school. You can have the session on the adolescent, and then training of ASHA, which is the very vital part of you as you become the MBBS doctor. Then it is your job to train these workers, ASHA workers, the counselors, and you have to teach these all people how to handle the adolescent. The most important part. When they come, so how you will handle how they have to handle adolescent. Because you know the psychology, you know the development, you know what is happening in them, you know what addiction they are going to be having. You can learn about various kind of drugs they are taking. Then next is the life skill education. I'll talk a little bit about it, but this is the most important part which you can do. First of all, you should learn what is it. Then only you can teach other. So more you can teach other, more you will learn. Then counseling. At least you can develop some counseling skills. So you can counsel your, anybody in the time of help, which is required, critical time. This is very important in case of, when the person is going to commit suicide, and you can identify that person and try to talk to him. You can save that person. That is why a stitch in time saves nine. You can imagine. You know that how to, plug in and how to catch, how to talk, how to identify. These are very important skills. A doctor should know. A medical student, this is the time when if you are serious about it, I think you can learn these all things. Then planning and implementation of health services, in which you can always see that adults and are part of it. And timely referral of a special need. If you have identified somebody and you find that no, I cannot handle, then I think I have to send to, endocrinologist, or maybe I think pediatrician, or maybe I think cardiologist. So you should send that person so the person can get adequate, referral. Now this is one experiment we have done. I need your attention for this. We have started a training program for our interns, and one training program we have conducted in our, Vardhaman Mahavir Medical College. And if you just talk to some of the intern who has got this training, that was actually where we used to call the interns once in a week, like on Thursday they have to come back in the department for 2 hours, and we used to take these sessions, and they were actually more of the interactive in nature. We brought Inox, we brought advocate, and also legal expert and social experts talking on these issues. And in the end, I got their responses, and they were so excited that we have never got such kind of experience, and we have never come across such kind of training in our undergraduate level, even 5.5 years. So you can imagine that the way we train our student is also making a difference. It only depends when you are serious, then we are there to help you. If you are not serious, like Molly has approached me, said that we want to learn about the adolescent health. I'm excited. I said okay, fine. Similarly, you can design the skills learning program. We can definitely help you. So you can see that what is sexuality. At least people should know what is it. What is gender? What is sexual orientation? These are the current issues. You will come to know that people are not coming to doctors just because they don't know how to talk to you, how to talk to them. Like when they are of third gender, or maybe I think they are having some problem with the gender. So because you don't know, because you have not learned, you never learned about sexuality, how to talk about sexual problems. It is never taught in our undergraduate level. That is why we are very naive and not able to. So therefore, such kind of training helps. And if you have learned these all things, I think you will become a little better than others. This is what I was talking about, life skill education. Actually, if you know these all skills, you yourself can manage your life much better, and you can help youngsters to have a better life. So there's a communication skill, assertiveness, negotiation, critical thinking, coping skill. These are very important skills. There are 10 skills, and they are part of it. So when you know the 10 skills, your life becomes different. And it is not that only the adolescent has to learn. We have to learn these all skills. Many times we not able to do it. So this is she's my niece. Coming together is beginning. Keeping together is progress, and walking together is success. So everybody has to join hand. Then only we can definitely make a difference. And this group, I am very excited to learn about it. That they are doing very good job, and I'm very happy about it. So I have finished my presentation and now open for any question if it is there. Yes, Hina.
If anybody has any questions, they can type it out in the chat box. And sir, if you can see the chat box, then okay.
Already I think
So
too many people have written. Uh, no, 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 no question. I thought there are
no questions as of now. Yes, sir. There's a question.
Yeah, video game is similar to any kind of addiction.
Video game
Yeah,
addiction.
video ham addiction. Video ham. Video
Video
game.
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 Yeah.
Video game
Video.
is similar to, like, we have so many addictions, and this addiction, this is one of that. And I've done very long time back one study. That time the video games were not there, but addiction to films. It used to come in the night, and even in villages, the children used to see the films in night. So not the porn one, but otherwise also. And I found the relationship of their liking of the films and their behavior. That's a very interesting one. You have the violence behavior because you like the violent films. You know, so it came to know that actually we learn many things from the films. But there is one school which says that no, this is not true. That films are teaching the student. But it's not also true. I do not agree with this. That many people say that there are so many games which are improving your skills, improving so many things. So both things are available. Yes, good things are there, but the bad things are also there. And when you are in the middle, then it's fine. But when you are towards any of the side, then things become difficult for you. So addiction is the when you have to label the addiction when you are not able to do your normal activity, when you are not able to enjoy your friends, and you are not able to do your performance of the school, and you are going down. That become addiction. Anything which are affecting your normal activities and you become socially isolated, then it become effect of the addiction. Till it is not there, then you should not call it addiction. When you are doing good job and you are also playing video game, fine, no problem. you know Nobody is saying. But problem is that you are identifying that what is addiction, and you are not into that trap. If you're not, then fine. Okay. Next is, I think, so many questions has come now. Sir, please share some good reading sources to learn about sexual health. Very, very good. Actually, the sexual health material resources are not available. The authentic and very good material is not available. That's a very unfortunate. Yes, in curriculum also we don't have very good. We have tried to make something for our school students, but we are afraid if their parents are objecting things. We have written a book, a small book, about the menstruation and reproductive health for our school student, for girls. I can share with that. I have that book. So similar to that, if you learn, you will come to know many things new, and which are not taught in the school. So you be in touch with me. I'll share some of them. Then next question is, there is, अरे यार इतना बहुत जल्दी जा रहे हैं questions. One by one.
So one of the questions is that how do we actively promote the need for learning these life skills, counseling, and soft skills in our own medical community?
Uh, this competency based medical curriculum is actually focusing on soft skill. They are trying that in extra time which is given nowadays, they should have so many soft skills. So I believe in future you will have more such opportunity to learn various kind of soft skill. But when we talk about this life skills, that is also part of it. If I always take this lecture, about the stress management and life skills in my college. So similarly, in every college, if they can have at least one or two lectures on the life skills, it's much better. Anyway, you can go on the website and have the videos on the life skills, and individual life skill you can learn through various activities, and also films are there. So I always present this crocodile and monkey, films, and teach my student about the various life skills and the what the monkey has done. You know, so monkey and crocodile story is very good in many things. So similarly, when you we have the punch karmas stories. So when a student, when you are the child, you used to learn for a fun, but now you learn them again, and you'll find that actually they are teaching so many things, and you can apply in your life. So revisit those all stories. Try to see that why they have been written. You'll definitely be enjoying. Any other question next?
So next is one of the question is that how do we do our part to improve our adolescent health related skills?
As a adolescent, like I told you, that when you are coming as a first year student, then you yourself know that I'm adolescent. And when you become the medical student, then immediately your role changes. And when your role changes, then you know that we have the adolescent and I am adolescent. So if you realize that, yes, I have to solve as a medical student, then you try to learn about it more. You try to, grab those all skills from here and there, and then see that how you can solve it. Rightly said that this will only come. All skills will come when you try, when you see that where it is available, you know, and the finding on the right place is very important. Whenever you find a person who is talking about sexuality, a person who is talking about life skills, then you should always go and join and try to learn about it. Then you will slowly learn that, yes, this is a very interesting branch, is interesting area of learning. And life skills is not, I told you, it's not only just adolescent, but for us also. You know, you should know that how to deal with life. That these are all skills which are required for us to be assertive, to be, making decisions. They are very important. When to take what kind of decisions. Therefore, I think it's very important. Yes. Next one.
Next is a very interesting question. How to maintain the stress level of being a very ordinary kind of person?
Yeah. Actually, when you are ordinary, you are stress free. So you have to be ordinary. But when you try to be something, you know, uh, want to be ordinary or want to be something, then the stress comes. When you are what you are, then there is no stress. The point is that, these are all skills like becoming doctor, engineer, or maybe I think, there are so many skills. So you learn it. Those skills should not come with the ego, should not come with the, something that I have become. Then the problem will arise. So at the same time, you should know your life, you know, you know your what you are, then problem will not be there. Therefore, nowadays we are focusing more on, you know, uh, yoga, meditation. So when you do the meditation at your age, I started, this all spiritual reading and learning. Many of the people used to say, "What nonsense you are talking about, and what you're reading." But now I realize that I have wasted so many years, although I've started very early. But in the midst of life and this all, ultimately, this pandemic of corona pandemic has given you the lesson. That lesson is that you have lot of money, and you have big house and everything. You require only one house, one room, not even big house. You require one room to isolate and small things to survive. You don't require so many things, and they are all useless. They are not going to help you. So what is required is understanding whole life, environment, relationship with the environment, animals. They are all very important part of our whole learning of life. And when you are making yourself cool down and understanding and having the meditation, then your stress level will go. You'll become. I teach stress management to our medical students, and there are many various methods by which you can do stress management. I teach various techniques also. When we know what is stress, how it originates, what is good stress and bad stress, how to identify the bad and good stress, then you know that what kind of stress I am taking. Is it going to be beneficial or not beneficial? So these all learning is going to be helpful to you. Yes, Emma.
Next question is that the problem with addiction is acceptance. So how do we tackle that as if people don't accept that they are addicted, so they cannot move further easily?
Yeah, they are in a phase of denial. Actually, again, we should understand that every problem has the natural history of disease, and I love to teach this natural history of disease as a public health person. The drug started with uh, you know positive reinforcement. Even in spite of, take an example of smoking. What is the fun of smoke? It's dirty, it's smell, and you are spending money. It's not nothing very great. But in spite of that, 30% of our population smoke, and it's keep increasing in youngsters like you. So it is actually because of, first you take it, then you get a very good kick, very good feeling, and that feeling is actually activating you, giving you reinforcement. you know so that if that reinforcement is not there, the good feeling is not there, you will not take again. The first day, if you take one beer, and half of the beer, it'll give you such a nice uh, memory and feeling and everything, so you will take again. If that feeling is not there, the kick is not there, you will not take again. So that is the phenomena of addiction. This is the basic of all addictions or drugs. So you have a positive reinforcement, then you start taking it. You take 2, 3, 4, 5, and when you take 2 bottles of the beer, then you say, "Hey, वो मजा नहीं आया, जो पहले आता था वो नहीं आया." या फिर 3 लेते हो, आप 3 लेते हो, उसमें भी नहीं आया, तो आपको लगता है यार बेकार में मैं नहीं सारी हरकतें कर रहा हूँ, इससे फायदा नहीं है, तो आप उसे छोड़ने की कोशिश करते हो, कहते छोड़ो। जब छोड़ते हो तो आप छोड़ नहीं पाते, क्योंकि फिर विड्रॉल हो जाता है, तब तक आपको विड्रॉल शुरू हो जाते हैं। तो विड्रॉल इज creating you negative reinforcement, and this negative reinforcement is forcing you not to leave, so you are in trap. लेकिन वो भी आप तोड़ सकते हैं, है ना? वही है कि अगर आप समझ जाएं सारी चीजें तो आप तोड़ सकते हैं वहीं पर भी। तो yes, you said that acceptance is very very important. If you do not realize that yes, I have a problem, how you can go? And that is actually insight. If you have insight, definitely you will go forward and improve it. If you don't have insight, it becomes a psychotic illness. And psychotic is, in addiction also you become psychotic. I'm not saying that you have a psychotic behavior, but psychotic means like you don't know that what is wrong I'm doing, you know, and what wrong I'm, creating. So that stage come very late, but I think most of the time you are, able to understanding, but the problem is you are not able to take decision, and that is a life skills which can tell you, yes, I have to take decision because this is not good for me, and I'll leave it. So acceptance is good, very important. Yes.
So just one last question. How do we promote awareness about mental health issues among adolescents and their parents and in the community too, so as to handle and lessen the stigma associated with mental health disorders among adolescents and young adults?
If he has listened my whole, speak or maybe session, I was trying to say that we have the problem, and adolescent we have various kind of problem. Suicide is the one which is quite common. But beside that, we have the schizophrenia, obsessive depressive, and we have the anorexia nervosa. These all things are common in our youngsters. But an addiction also, like all various kind of drug addictions. Now, once we know it, the problem is actually I was talking about that uh, how you can control it. I just miss the what I was trying to say. Uh, this question was big, so I just forget now what I was trying to say. Anyway, so my whole session was on this, that how to make yourself and become the part of it, a better educator or learner, or maybe uh, so if you're really interested in solving the adolescent health problem, at least you should be oriented to learn about it, and how we can talk to the parents. When you know the different kinds of problem, then you definitely know how to talk, what to talk. And another one is, you have to learn about the psychology of the child. Now, when we talk about counseling, or say the counseling techniques, in which you have to see that in counseling we need not to be judgmental. So when you know what is judgmental, then you will learn that we need not to be judgmental when we talking to the young person. Because once you become judgmental, then become problem. And the problem with the doctors is that, young doctor particularly, we become so judgmental. As soon as the patient say something, we become judgmental. ये क्यों किया? तुम्हें ये करना था क्या? अरे यार, तुम्हें ये समझ में नहीं आता, तुम्हें इतना भी नहीं आता, तुमने सीखा नहीं अभी तक। मतलब यू जस्ट स्टार्ट सेइंग, उसको इतना ब्लेम में डाल देते हो। क्यों? कहता है यार मैं इससे बात करना है तो मेरे को, तो गिल्ट में अगर डाल दोगे उसे, प्रॉब्लम हो जाएगी। एनीवे, दीज आर ऑल एक्चुअली skills and training which you learn slowly. You will not become expert of overnight. But what I am saying, that you can join courses, you can, we have the good parenting courses, we have the life skill courses, we have various counseling courses. So uh, okay.
Thank you so much. Thank you so much, sir, for this interesting and very, very informative webinar. It was, I feel, very essential for the future medical practitioners to understand the in depth, the importance of adolescent health and how they can help to improve it. We are very grateful to you for sharing your expert insights on the topic. And now we will share a post webinar questionnaire in the chat box. So all the participants, please do fill the questionnaire.
I
Thank you
can
so
leave.
much, sir, for joining us today.
Okay, thank you. Namaskar. मैं जाऊं ना?
जी sir, thank you.
Okay.
Hello everyone. The post webinar questionnaire has been sent in the chat box. Please do fill the questionnaire for certificates purposes.